Sparking emotional resonance is crucial to get people engaging with health in new ways. But how do we move from thinking to actually doing with sustained action and widespread participation? Today, we delve into the second stage of movement building, adoption. In Movements for Health, this means going beyond consumption to co-creation. The power and energy of social movements arise from a network of individuals, all motivated to work towards a common goal. It's not about people passively consuming health information or services. It's about shifting them to become active agents of their own life and ultimately active producers and co-creators of their own health, and influence others to do the same. This approach generates genuine community ownership and leadership so that it's not only sustainable but truly generative. In our M4H guidebook on Design the Good Life, you will find Beyond Social Services example on how they worked with their community leaders to start community initiatives for health. These were not simply programs and services delivered to and for the community, but they were co-created with the community, leveraging the strengths and resources already present within. Community leaders in Lengkok Bahru started a series of community health initiatives. For example, there was Healthy You and Me, a group that started Community Fridge and set up a hotline providing community members with access to health, information and resources. There was also the Young Mums Initiative, a peer support group for young mothers during this stressful period of their lives. While we normally focus on sharing the what, here we focus on getting the community leaders to start with the why. In learning to connect with their story of self, their own personal experiences that had led them to want to make a change, not just for themselves but for their community, they discovered that their voices and stories have power, the power to connect and truly motivate others to action. This demonstrates the power of community-led initiatives for health, in leveraging the strengths, stories and experiences of residents themselves to become a positive influence for others and to inspire change. The principle of co-creation, moving people from passive consumers to active producers of health, extends beyond community initiatives. Next, we will look at the LACE team at NHCS who recognized the transformative power in working with patients as co-creators in designing their own support groups and health solutions.
Local Area Coordination Empowerment is a one-of-a-kind model of care that started with social workers and proliferated across National Heart Centre Singapore, bringing together a group of healthcare professionals who share a common purpose: to gain a deep understanding of the concerns, aspirations, and lived realities of heart patients. Similarly, to co-design meaningful ways with them to support them. Traditionally, patients are seen as recipients of care. LACE challenges this paradigm by recognizing patients as partners and co-creators of solutions. This human-centered approach aligns with M4H beliefs in people as active agents of their own lives, fostering sustainable and compassionate support systems.
Our early attempts to form a patient group offered valuable lessons. We realized the importance of having a clear vision, being intentional with our purpose and outcomes in working alongside partners. We also position ourselves with care, so as to not overshadow the patient voice. This experience has taught us that slow is fast. When we step back and give patients the space to lead, genuine ownership and energy emerge naturally. And that's how Heart Warriors came alive.
Having lived with a heart condition from a young age, I understand the importance of emotional resilience deeply and not walking this journey alone. Today, as a core member, I help shape the group's strategic direction, from welcoming new participants to nurturing future leaders. Drawing on my background in PR, marketing, and media, I use my skills to amplify Heart Warriors' reach and connect with more patients. I also lead meditation sessions, offering a space for healing and reflection, and show others that they too can step forward, contribute, and find strength in community.
This is what co-creation inside healthcare looks like, when professionals
and patients working side by side,
building something meaningful
and sustainable together.
Ultimately, adoption in Movements for Health is about empowering individuals and communities to step up, take ownership, and become active co-creators and leaders in their own health journeys. The power lies in this collective action, nurtured by shared purpose and empowered leadership.